everything makes it into the headlines, but we bring you the full story. Join Uchenna Cyril Anyoke, a renowned media personality and former president of the Nigerian Publishers Association, as he unpacks the real issues behind the news, from politics to public policy, economy to human rights. Nothing is off limits. Expert guest, in-depth conversation, local and global perspective. New episode every week on Facebook and YouTube. Watch now on Freedom Square TV. Follow for updates and behind the scenes clips. Beyond the headlines, beyond the news.
Good morning and welcome to another interesting and enlightening edition of Beyond the Headlines on Freedom Square TV. We are reaching you from Enugu. Enugu is the capital of Coal City, the capital of Enugu State. We call it Coal City State. And of course, if you are joining us for the first time, Enugu is the capital of former southeastern Nigeria, eastern region, Old Anambra State, and there is the home of Jim Ifeanyi Chukwuobodo. Today, we focus on one of the most important gifts of life. That is vision, our ability to see. Across communities, more young people are wearing glasses than ever before. At the same time, many senior citizens depend heavily on spectacles to read, drive, walk, and carry out everyday activities. The big question is, what is responsible for this growing dependence? Is this a normal part of aging? Is technology affecting the eyesight of younger generations? And what can we do to preserve healthy vision for as long as possible? These are some of the questions that will be answered in a short while on this conversation, The Vision Divide, comparing spectacle dependency on youth and seniors. Because I'm already a senior. To guide us through this important conversation, we have in the studio a renowned eye specialist, a consultant ophthalmologist, and Deputy Chief Medical Advisory Committee of the ESU Teaching Hospital, Park Lane, here in Enugu. Is Dr. Bernard. Doc, good morning, and thanks for joining us.
Thank you very much.
Okay, let's just start from the basic. When they say spectacle dependency, what would that mean?
Spectacle dependency is just the ability of one, or the tendency of one to depend on spectacle to carry out his everyday activities.
Yeah, that's like you...
Like reading, driving, doing the chorus at home, and even watching television, especially in the younger age group.
That means you can't do those things without that.
Yes, without the spectacle, those things will be difficult for you to perform those activities. So you may need other extra or secondary alternatives like spectacle.
Okay, growing up, a lot of people will always say, when you begin to wear glasses, it has a way of looking in your eyes. How true is that?
It's not true. It's not true. It's just what I would say, might. People always say, even when the young ones see any person putting on a spectacle, they will assume that the person is old and the person has no more life in the person because of age. No, it's not true. It's not true at all. It doesn't damage, rather it gives the person clear vision to perform the daily activities of daily living.
Okay, but okay, can you talk to our viewers and tell them what are the major reasons people may need to wear glasses or spectacles? What are the reasons?
The reasons why people may be dependent on spectacle are, let me say, dividing the thing into two, within the youth and within the elderly. Talking about youth, to really be able to perform your activities of daily living, that means you have good vision. And to have good vision, that means that everything about your eye will be intact. And you won't have any problem of refraction, because refractive error is the commonest cause of wearing spectacle.
What is refractive error?
The
what does that mean?
refractive error is it's a little bit scientific definition. It's just an error of refraction of rays of light that falls on the eye. These are the optics of the eye. And when they are not normal in an individual, that image will not be formed at the retina. So you can have two types, basically two types, when the image is forming in front of the retina, not at the retina, giving you broad vision, or when the image is falling away or beyond the retina, still giving you blurred vision. There may be other ones like astigmatism, where the curvature of the eyeball will not be normal. So when you're in a situation like that, it will be difficult for the optics of the eye to now refract those rays of light to that point in retina where the image will be formed, and will now be connected to the brain to give the person better vision.
Currently, we are seeing a spike, an increase in the number of young people who are having vision issues. Has this always been the case, or are we noticing this because of technology?
Yeah, really, we notice it is because of technology, I have to say. Because before this time, it would be difficult to see people going for certain tests about their vision. Like in school eye health. People do not even in developing countries, they do not know much about children's eye health or school eye health. But these days, people can now make it kind of make it compulsory that at a certain age a child must go for eye tests, even in school or every other places. That from there, that's where they can now pick those people that have refractive error. It has been with them, especially refractive error, that the person can still be managing, carrying the thing up to the point when the thing will now begin to disturb the person. But if there's a better technology that we have now, and people are now becoming aware, using phone call, our phones will be difficult for the person. Reading near things will be difficult for the person. The person will not be doing well in the class. So with this kind of disturbances, it's now a kind of something that will push the person to go and do some eye tests, and it will be difficult discovered and then appropriately managed for the person.
Let's look at these days because of technology. A lot of our younger generation, younger people, are exposed to what we call excessive screen exposure. How does this affect the eye of the younger ones? Being glued to the phone, the computer, the laptop. These days, you say somebody, just a child, he wakes up in the morning, the person does use his phone, his eyes is there, morning, afternoon, night. But if you ask him to come and eat food, as eating food, he's also looking at the screen.
But to the best of my knowledge, there's nothing that screen does to the eye that much, except that yes, it can give you stress. It can stress the eye, or because the eye is meant to be used to see. So there's no point attributing anything that that happens to the person because he's using screens that as a result of that computer or whatever. The eye is actually meant to be to give you vision. So the only thing you can get from this is that it will stress your eye. Once it stress your eye, maybe you start tearing or you start rubbing on your eye. Children, that kind of rubbing, it distorts the curvature of the eye. It will now result to a significant something like astigmatism that will now bring that discordant in optics of the eye, and the image will not be formed in the retina, and the person will not have blurred vision. Except you see it from that perspective. Otherwise, looking at screen, using phone does not affect the eye.
Okay, that's something you are letting us, because people always say, boy, you know how long you're on that screen, though. But why do they have in computers? There's a device they have that protects.
Yeah,
why is it so if it's not affecting the eye?
That's what I'm saying. It's just the stress.
Okay,
Stress.
So if you continue to stress the eye, it could also affect.
That's what I say. When you continue stressing to stress the eye, the next thing is that you may start tearing, bringing out tears, and the next thing that you may now start rubbing on your eye, and the next thing that follows is that the curvature of the eye will now begin to become abnormal. And in that instance, the rays that strike on that optics of the eye, especially the cornea, will no longer be focused at that particular point where it should be focused at the retina. It will now give you blurred vision. That is astigmatism.
So maybe you have to reverse that. It means that excessive use of screen
Well, it's
can also affect the eye.
yeah,
in the long run.
not directly, not directly.
Okay. Okay. I'm a father, and you are one, and some of the people watching are parents. What signs must they watch out for? I'll begin to let them know that something is beginning to happen to their eye. What are the things they begin to notice? They say, okay, I think I need to see an ophthalmologist or something.
So is it in relation to spectacle? Or
Yes. Even the eye as itself, because you need to know that something is wrong with the eye.
In this case, let's not just divide it into two: the youth and the elderly.
Yeah.
You see, the youth, you normally find or discover that they have refractive error from their school, the nursery school, primary school, and that is when you catch them young. The aunties in the school, the teachers will be the one that will now notice that this person is staying very close to the board or staying away, that kind of thing. So with that, the person will now inform the parents. Apart from that, some ophthalmologists go to schools now to do those screenings in the school. Like I said before, technology, so to say, has helped us because we now discover this in earlier than before. So if the refractive error is discovered in the school and even at home, because the parents will now begin to see their children staying very close to the television, and even difficult in reading, and even the adolescent difficult in driving. Something is wrong with my eye, I have to go see an ophthalmologist. Then coming to an elderly, apart from this refractive error, there are other things like presbyopia, when the person will now be having difficulty in reading tiny close things, especially from 40 years for males and 38 to 39 years for females. So it's because of loss of accommodation, inability to see close things. So that one is exclusively a problem of the elderly. Then there are other conditions we call age-related eye diseases. Age-related eye diseases, commonly in elderly, like glaucoma, cataracts, age-related macular degeneration, diabetic retinopathy, hypertensive retinopathy, and all this. These things will affect the eye, in addition to refractive error. That means whatever happens in the youth, plus these age-related situations in the adult, they are the things that the person will not have.
That's quite interesting. Can vision problems be prevented?
Yeah. When we come to visual problems, some can be prevented, some cannot be prevented. Prevented in the sense that, of course, if you know that trauma will hit your eye, it will give you problem in the eye, you prevent it. And if you have there's a situation, infective conditions, epidemics that will affect the eye, if you prevent those things, you stay away from it. And if you have something like diabetes, the earlier you now discover that, go to doctor to check that you're diabetic, you now begin to sort yourself out so that it doesn't get to retinopathy, especially the proliferative type that will give you blindness very soon. Or if you're hypertensive, you see your doctor, blood sugar is blood pressure is okay, then you're already preventing diabetic hypertensive retinopathy. So, or even if to avoid trauma, certain times you just try to use your eyeglass. That is what they call the preventive eyeglass, so that at least they are like Okada people, so that something flying will not enter their eye, and it's preventive.
Okay. You said that seniors are prone to cataracts.
Yes.
And so, how do cataracts change a senior's glasses prescription? How, if I have it now, how will it change my glass prescription? And will I still need a spec, maybe after a surgery, cataract surgery?
Yeah, it's in cataract. What happens in cataract is the major refractive index of the eye that's supposed to be transparent, then becomes opaque, and that is the lens. So, like I said before, it's a more scientific something, the ray diagrams and all this. Once the lens becomes opaque, light cannot pass through it to the retina. as against when it is not opaque, very clear. Light rays can now pass through it and be refracted to the point where the image will form in the retina. So, because of that opacity of the lens, it will now be difficult for light rays to pass. And the person will now begin to have scattered focal points because of the opacity, and it gives the person blurred image. Now, if the cataract is extracted and appropriate procedure used, the power of the lens will be restored. But it may not be very exact. So that's not being exact. It's what you may need to be added to that spectacle after. But if everything is okay, specifically done with those results you get from machines you use to check the lens power and all these things, there may be no need for lens and that spectacle after.
I've heard about what a rule calls 20-20-20. What does that mean?
20-20-20 means at 20 years you may have 20/20 visual acuity, and at that 20 years is usually when the eyeball will now begin to will cease to develop because of the position in the orbit. So if you have myopia, for example, because the eyeball is too big, at that 20, you may have some relief because the eyeball is no more growing and the orbital bone is now compressing on it, so it retards it from growing further. So that is when the person will now begin to say that at that age, that is now beginning to see better than what he used to see, before.
Between the youth and the seniors, of course, you've seen a lot of patients, the young and the old. Which of this group will you say they are more compliant with wearing their prescribed glasses? Because you can prescribe, give. I mean, because that some people just use their own for a small time and abandon it. So, which people are more compliant? The young ones or the elderly?
Obviously, it is difficult to say because, these days, let's just, what is the reason for now going to get that spectacle from the doctor? Because of the poor vision. But you find out that some people, especially the young ones, do not want to wear. They don't like to wear because of that might I told you. They think that wearing spectacle is a problem of elderly. Even when they will be suffering the thing, like I told you, on the background of that refractive error, they can still cope.
But they are much younger.
Yeah, because they're much younger. But an adult, elderly, you must have that secondary interference. If it's cataract, you remove the cataract. If it's glaucoma, you treat the glaucoma. If it is age-related macular, you try to address it. So, in all, adult cannot do without spectacle. But the youth may want to try it for some time. So, the elderly depend more on spectacle.
Most people find it difficult to go for eye checkups. Just routinely, like they would want to do a malaria test and all that. And so, how often should the teenager get an eye check? And how often should the senior citizen get an eye check? Is it something you do once in a year? You don't want to do in 6 months? You don't want to do in 3 years? How often? What's the recommendation for the young ones?
There's no absolute recommendation of time you should go. The young ones, once the person begin to have the problem, once you have problem in the eye, when there's any problem, you will be alerted and you will be disturbed, and you must go to check your vision. But in developing countries, it's difficult for us to take things serious, especially our health. More so, the eye, we have two eyes. You may not even know that the other one is going bad, when the other one is okay. So it makes you to now delay. But in adult or elderly, for example, once that primary cause sets in, those symptoms is what will make you to go to the hospital. And that is when you will now be checked and appropriately advised very well.
Okay, let's look at lifestyle choices. What can diet? This story, we'll come to that. Lifestyle, okay, how can diet, lifestyle changes, protect the eyesight in either group? Or is eye problem mostly genetic?
Well, eye problem is not mostly genetic, but very few are genetic, like glaucoma. Glaucoma is genetic to a greater extent. And that's why we advise families of people with glaucoma to go and have their eyes screened, because if you discover it early, the management becomes easier. Diet and lifestyle, of course, can affect vision. The way you see. For example, a boxer always most likely will have eye problem than somebody that is not boxing because of the trauma. Or a sickler will have eye problem because of the sickle cell effect in the retinal vessels than the person that doesn't have there's no sickler. And some vitamins will have vitamins to help in in the eye, like age-related macular degeneration. The mainstay in management is use of vitamins. So vitamins help, good lifestyle help, preventive being proactive in preventing certain things will equally help.
Okay, there's this myth, or is this theory, or is this factual, that if you eat carrots enough as part of your daily meal, it can improve eyesight.
Well, to some extent, yes, but not completely, because it's because of the vitamin A content. And that vitamin A content mostly in the young, the infants. As an adult, I don't see what you're doing with vitamin A vis-a-vis your the eye vision. It's mostly what the infants use, because that they need that vitamin. Even mothers, pregnant mothers, still need vitamin A. So apart from that, I don't see any other thing that cattle can do in the body, except other vitamins contained can equally help, yes. But it's essential the vitamin A, carotene in that carrot is what people think it's kitchen throughout life. It's not true.
Okay, what of exercises? They said there's some kind of eye exercises you keep on doing them that can help you eliminate the need for glasses.
Well, the only eye exercise I know is that you blink as much as you can. When something wants to enter your eye, you blink. There's no other eye exercise that will help you to nothing like that eye exercise again.
Let's look at what would I call this? Permanent surgical. There are some permanent surgical operations like they call LASIK.
Yeah,
LASIK.
yeah.
Or less replacement. How can they are they both common in adults, or are they related to the youth?
And like I said before, refractive error is more common. That will make somebody to be spectacle dependent is more common in the youth. That's the refractive error. So, and these modern interventions are what you use to treat refractive error. Like LASIK is when you now make a permanent scars on the cornea, either to flatten the cornea to correct that particular refractive error, or to make it to more cool to not correct the refractive error. But the irony there is that it's permanent. So once you've done that, you cannot reverse it. But using spectacle, as the thing gets worse or gets better, if it will ever get better, you can now be changing your spectacle. That is why spectacle is out. The other one is surgery done in the eye itself, and it's permanent. And it's not commonly done in our environment.
Where is it done?
Done in the developed world, no.
So we're not developed.
We are not. We're not even developing.
Okay. Do you think children on their own can wear glasses safely without parental guidance?
No. The parents must guide, because they see it as toy. You see the thing, so the parents must guide. And there is particular spectacle frames you use for children.
Can glaucoma lead to blindness?
Seriously, that's the commonest cause of blindness, irreversible blindness in the whole world. Second to glaucoma, to cataract.
Reversible.
Irreversible.
That's quite frightening.
And it's common with us. And Southeast geopolitical zone is common with us more than any other zone in Nigeria. From study done in Nigerian, sometime national studies done by Nigerian ophthalmologists.
Self medication. Is it? Is self medication for eye problems advisable?
No. Depends on what we call self-medication, because when you go to hospital and the doctor prescribe a particular drug for you, you are going to take it home and be using it as first
It's
medication.
when you decide on your own to buy drugs that nobody is responsible for you.
It is very dangerous.
Okay, vision loss. This is always the normal part of aging.
No, like I said before, your vision loss, it has to be affect every human being, both children, adolescent, and elderly. So you can lose your vision when you're very young, maybe from trauma, maybe from infection, maybe from very high refractive error. Because refractive error, they have not told you how to manage the refractive error.
So how do you manage it?
You manage it with spectacle only. You manage refractive error with spectacle, and that kind of surgery you mentioned before. And in course of managing the thing, what you're using, that's deficit, the inappropriateness of those optics of the eye has created, is what you now replace in form of spectacle. That is, it has power. This glasses has power. So when you replace it, of course the person begin to see well. But if it is not replaced, the person will be having problem. Like a short-sightedness, that's where the person sees a near thing than something that is far. Maybe simple myopia, or high myopia, or pathologic myopia. You may so correct it with minus lens, maybe simple -1, -2. But you will have up to -5 in some instances. And you have up to -18 in some instances. You cannot see the variation. While in the other one, the long-sighted, that the person sees more than sees near, you correct it with plus lens, that is convex lens.
Is there one thing you can tell the person? If you do this today, it will protect their vision.
Yeah. If you live excellent life.
What is excellent life?
Excellent life, not indulging in violence, or if you have any eye problem, no matter what, visit your doctor. It will help.
Now, the final advice to all the viewers, as a consultant ophthalmologist, just like a concluding remark.
Okay.
Talk to our viewers on what they should do, what they should not do. Just summarize all you think is necessary for them.
Okay. In summary, once somebody begins to have blurring of vision, you should visit the ophthalmologists. Do not use traditional eye medications because it brings a lot of confusion and destroys the eye very well. If you have other systemic conditions like diabetes, hypertension, you should visit your doctor so that it will be treated in time. If your father or your mother has glaucoma, or any person in your family has glaucoma, it's nice that you go to hospital for glaucoma screening, because the commonest cause, what we commonly know today as the cause of glaucoma, there's no cause of glaucoma we know today, but we have the risk factors, and family history is the greatest risk factor, especially if you're an African black. And maybe if you're from Enugu, from Southeast, where the thing is common compared to other zones.
Okay, you've heard it from the expert, Dr. Bernard Ani, who is a consultant ophthalmologist with Enugu State University Teaching Hospital, Pakile in Enugu. Bernard, I want to thank you for sharing your expertise and helping us better understand the differences in spectacle dependency between the young and the old. And to our viewers, I want to thank you so very much for joining us on this edition of Beyond the Headlines. And we do sincerely hope that when next time we on this program will join us. But remember, healthy vision is not a luxury, it's a necessity. Take care of your eyes, schedule regular eye examinations, and encourage your loved ones to do the same. Until same time tomorrow, stay informed, stay healthy, and keep looking beyond headlines. Have a lovely day ahead of you.